This is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran. And introduction part, chapter number 3, what is to be cured in disease. And this chapter is totally adapted from the chapter 9 of the Spirit of Homeopathy. Vital to developing the homeopathic vision is the understanding of what is to be cured in disease. It is to be able to perceive, to feel, to know as the truth that disease is not something local but a disturbance of the whole being. It is to have the unshakable conviction that if we treat the disturbance at the center, the local problem will lessen. It is to understand that remedies in potency produce the central disturbance alone. These points need to be stressed repeatedly, explained and exemplified so that they become a part of our thought process. This and only this conviction can make us staunch and successful homeopath and remove from our mind the confusion that arises in the practice. This vision will make serving things clear, and the rule and principle of homeopathy will become absolutely logical derivatives and no longer remain dogmas. Questions about the importance of mind, the difference in the various approaches to totality, the evolution of symptoms, the importance of pathology, the site action of the remedy, selection of potency, and the prognosis of the case. All these questions will be solved quietly, easily once this vision develops. It is for the reason that I am writing this book. We are going to begin with one of Hahnemann's most profound observations, which he mentioned in aphorism 211 of the Organon, namely that the mental state often chiefly determines the choice of the remedy. We are going to examine what a mental state means. We are going to talk about the peculiar characteristic symptom and how they too represent the central disturbance. We will see the oneness of Kant's Bogers and Waringhausen philosophies. We will use case illustrations to bring home all that we have said. In aphorism 211 from the organ I read, this holds good to such an extent that the state of disposition of the patient chiefly determines the selection of homeopathic remedy as being decidedly characteristic symptom which can list of all remain concealed from the accurately observing physician. Look at the word. It says the state of disposition, the state and not the symptom. Hahnemann did not write this hold true to such an extent that mental symptom determine the choice of remedy. Try to understand. He did not ask us to record the symptom. He asked us to understand the state of the patient's mind. Don't write contradiction, intolerance of, or dictatorial. These are the all mere symptoms. Understand the state of mind from which these symptoms arise. If you look at the symptom, you will be led to many remedies. But if you look at the state, there will be only one. Every remedy has a different state of disposition. Aphorism 212. The creator of the therapeutic agent had also had a particular regard of this main feature of all disease, the altered state of disposition and the mind. For there is no powerful medicinal substance in the world which does not notably alter the state of the disposition and mind in the healthy individual who tastes it, and every medicine does so in a different manner. Each remedy has a peculiar state of mind which is characteristic to it. Each remedy produces a state. Each patient has a state of mind. If you compare symptom, you will be lost in the jungle. If you understand the state, you will find that there is only one remedy which produces that state. Now in aphorism 211 says, the state of disposition being characteristic which can list of all remain hidden from the accurately observing physician. Look at the word. We say mental state are most difficult to get, and Hahnemann say it is least of all remain concealed. From whom? From the accurately observing physician. The world is observing it. If you are able to observe, no patient can hide his mental state from you. He never wrote it can list of all remain hidden from the accurately inquiring physician. The physician is an observer. mental state has to be found mainly by observation and not by inquiry. You have to look, you have to see, you have to understand, and you have to feel the state. You have to experience the experience of the patient. This is the art of case taking, especially when mental symptoms. It is not just asking question like, are you angry, or are you sad, are you depressed? A remedy that covers the mental state and general symptom of the patient has to got a greater possibility of curing than the one that covers the particular without covering the mental and generals. This is the one of the lessons I have learned from the practice. And so, in so many cases, I have prescribed on mental and general, missing the particular symptom in the repertory, and I have been successful. But when I try the reverse, I have always failed. If a remedy covers the particular without covering the general and mental, it is bound to fail. Most of you will agree with me that the two principles that I have given are not entirely novel. They have been emphasized by many masters and teachers of the homeopathy. Now, what is the explanation for those observations? The explanation is the key with which many doors of our philosophy can be opened, and the key to reduce the difference between the various approach and school of thoughts in homeopathy. One of the principles of logic is the controversy arise out of ignorance. When there is a knowledge, there is a no quarrel, because truth is one. So, in a person who seems to be knowledgeable but who quarrels, there must be ignorance. We will try to resolve the conflict between the various schools, and explanation will resolve many of them. Now, know the what is curable in disease. In the third aphorism of Organon, Hahnemann describes something very fundamental. The third aphorism is perhaps one of the most important of the Organon. He says, if the clinician clearly perceive what is to be cured in disease, that is to say, in every individual case of disease, means the knowledge of disease. If he clearly perceive what is curative in the medicine, that is to say, in which each individual medicine, it is a knowledge of medicine or knowledge of medicinal power. And if we know how to adapt according to clearly defined principle, what is curative in medicine to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must be ensured. To adapt it as well as respect to the stability of the medicine, most approach according to its mode of action to the case before him, means the choice of remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of it required, means the proper dose and the proper period for repeating the dose. If finally he knows the obstacle to recover in each case and is aware of law to remove them, so the restorations may be permanent, then he understands how to treat judicially and rationally, and is the true and he is the true practitioner of the healing art. Get the meaning of it. If the physician clearly understand what is to be cured in disease, does this make sense? Disease have to be cured. Hahnemann writes in his first and second aphorism, the physician's highly on a mission is to restore the sick to health, to cure, as it is termed. The highest ideal of cure is rapid, gentle, permanent restoration of the health, or removal or annihilation of the disease in its whole extent, in the shortest, most reliable, and most harmless way, on easily comprehensible principles. Cure is a removal of disease. So disease has to be cured. Then why is he writing in the third aphorism, what is to be cured in disease? I consider this word in to be very important. The person who knows what is to be cured in disease will succeed. I am stressing this point again and again because it needs to be stressed. If you have a clear concept of what is to be cured in disease, we will cure. If we don't, we will not cure. Step by step, we are going to use logic to try and find the answer to these questions. The first is aphorism 116. Some symptoms are produced by the medicine more frequently that it so that is to say in many individual, other more rarely or in a few person, some on very few healthy bodies. Again repeat, some symptoms are produced by the medicines more frequently, that is to say in many individual, other more rarely on or in a few individual, or some on very few healthy bodies. This refers to proving. When a remedy is proved, it produces some symptoms which are common to all the prover, some symptoms which are common to some of them, and some symptoms which are the symptom of the individual prover. This means that the drug, when given to 100 provers, will develop some symptoms which are common to all of them, some which are common to 30 or 40%, and there will be some symptom that only individual prover will produce. Now, which are those common symptoms that all provers will produce? If you read the Materia Medica Pura in the introduction of Brainia and Rustox, Hahnemann observed that whoever be prover, whatever be the symptoms, Brainia will be aggravated from the motion and the Rustox will be ameliorated by it. These are the pure data of the observation. Now on the label, mental state and mental state versus mental symptom. This means that general modalities are common to all provers. In aphorism 212, we have already read that all remedies produce a mental state in all prover which is peculiar to that remedy. Whoever be the prover, suppose aconite will produce violence in the mind, stamonium will produce terror, and the pulsatilla will produce a tearful disposition. Hahnemann writes of aconite that it cannot be given to a calm person. So, the second things a remedy produce that is common to all prover is mental state. I am trying to point out that having a mental state doesn't necessarily mean that the mind is affected. Mind is a state which is produced in all diseases and in all the prover. The center has to be captured first. This is the law of disease. There can be no affection of the part without the affection of the whole body or a whole person. There can be no disease in the organ without central disturbance. Our medicines are potentized. This means that there is no material dose remaining in them. There is no physiological effect. Digitalis has the effect on the heart in a physiology, not in homeopathy. In homeopathy, digitally potentized become a dynamic agent that causes central disturbance at the level of mind and generality first. And then if there is tendency to heart trouble, then it will be affected. And if his prostate is susceptible, then this will be affected. If his liver is weak point of them for that prover, it will affect his liver, and if he has a tendency to insanity, he will become an insane. Digital is no longer remain a heart remedy. Kant write that it is one of the best remedy for a prostate. Somebody write that it is good remedy for liver trouble and jaundice. Somebody else write that vertigo from hunger is in a digitalis. Digitalis is not vertigo, not heart, not liver, not lung or spleen. Digitalis is a dynamic disturbance which is produced in the prover. The term local remedy when it is used for a potentized drug is a misnomer. There are no local remedies when they are potentized. It is clearly written in organon that remedies have the dynamic effect only. Potentized medicines or remedy have dynamic effect only. There is no physiological or pathological or organic effect. If you fundamentally give you many more particulars but not as many more generals. All the particular symptoms for which you are searching can be missing, like caliadatum was not proved nor given as a remedy for the person who had a tendency to leukoderma. Therefore, you missed it. But the craving for motion in open air, bilaterally symmetrical affection, and the state of mind with loquacity and jesting were produced in most of the prover. Therefore, if the remedy clearly produced mental and generals, you can assume that if proved in a susceptible person, that remedy would have produced the same particular, means local effect. But if you see a remedy that produces particular, can you assume that it will produce the same mental and generals? No, impossible, because it had the opportunity and it did not produce them. That is why we say The remedy that covers mentals and generals has got much greater possibility of curing than one that covers particular without covering the mentals and generals. It is the central disturbance that comes first, and then this central disturbance will go and act upon those organs which are more susceptible. But with the with the modus operandi of like type of characteristic action of the central disturbance. So, does the modality represent the central disturbance or the pathology? The peculiar modality represents the central disturbance and not the pathology. The peculiar modality will show you who is the culprit, the cause, arsenic or phosphorus. Suppose your house is susceptible to robbery and the robbery has taken place. Does this information give you the name of the culprit? No, the way in which the act of robbery was executed will give you the name of the culprit. The morality will give you the identity of the fellow at the center who is causing all this trouble. The name of pathology will only point to individual tendency. What is to be cured in disease? It is the central disturbance that has to be cured in disease and not the pathology. That is the secret. I like to compare disease to the mafia. The mafia organization, we may assume, is government by certain definite rules and principle. The first rule of mafia is only one don can rule at the center. Unless the don control the center, he cannot act on the periphery. The reverse is not applicable. They will not allow the second godfather to operate. There will be only one godfather and he has to control the center. Otherwise, he cannot operate his struggling and other rackets. Once you cure the central disturbance, then it is aggravating influence on peripheral pathology will disappear. Once you remove the central disturbance, once you remove the PNEI system, means psycho-neuro-endocrine immunological disturbance, it is aggravating influence on the peripheral pathology will automatically disappear. If you remove the mafia boss, all the struggling and other activity will automatically stop. Try and stop the smuggling locally and nothing will happen. Try to stop the drug racket and it may stop for a time being, but it will come back again. But if you identify the boss and hit him on the head, then everything will stop. As long as you handle the particulars as particulars or a particular, you will not succeed. The moment when you catch the central disturbance and central thread of one remedy, the central thread of the patient is PNEI system or a disturbance, everything will be fine. The other things that become clear is that since there is only one central PNEI disturbance, all the four systems must indicate the same remedy state. That means if a person has a mental state, you cannot prescribe on its alone. You must expect concomitant in the neuroendocrine immunological system. If you have a nervous symptoms, you cannot prescribe on it alone unless there is no contradiction at level of mind endocrine immunological system. To summarize, we have to focus in every case on the central disturbance. It is the factor behind all local problem. It can be identified especially from the mental state and the general symptom. The local particular are also indicative of the nature of the central disturbance and hence can be generalized. The central disturbance being the same all over. We can find it indication concomitantly in more than the one pair. And this easiest way of identifying it is you have to understand the mental state.